Good afternoon and welcome. We'll be starting momentarily. Welcome, everyone. We'll be starting momentarily. Thank you. All right, Hallie, do you want to start us off?
Yes, thanks. Thanks, Maria. I just want to start by saying thank you to all of you who are here today. We really appreciate you taking the time to join us. I'm Hallie Benasuti. I'm the Director of Research Grants at the National Bleeding Disorders Foundation. I'm joined by my colleague, Maria Santallea, who is our Vice President of Research Strategy. And today we're going to be talking to you about the funding opportunities that NBDF offers for researchers and other health professionals. So to begin, I'm going to tell you about NBDF's mission because it really is the heart of all of the work that we do at this amazing organization. And if you're interested in applying for funding from us, it's really important for you to keep this in mind for your applications and in trying to cater your project to fit our funding opportunities. So the National Bleeding Disorders Foundation is dedicated to finding cures for inheritable blood and bleeding disorders and to addressing and preventing the complications of these disorders through research, education, and advocacy, enabling people and families to thrive. So our funding opportunities that we offer are housed within the research department. The research department at NBDF has a lot of cool initiatives going on that all intersect, and I'm just going to give you a brief little overview of these. I could talk about these all day long, but we have not that much time available to us today. So one of our really important initiatives that we have going on right now is Community Voices in Research. This is our patient-powered registry. And what this does is it collects information from our lived experience experts who are patients and their families and caregivers affected by bleeding disorders. We like to call this population lived experience experts, a name that they chose for themselves because they are truly experts in what it means to live with a bleeding disorder. And what Community Voices in Research does is it is a registry for these patients that then allows us to gather their data and their information, their priorities, their day-to-day experiences, and then use that in research that can then directly impact their lives. Again, the research department also houses the grants, awards, and fellowships that we'll be talking about today. We are also where the Bleeding Disorders Research Collaborative, or previously known as the National Research Blueprint, is located. This is a really phenomenal initiative that is working to get those lived experience experts into leadership positions in research. And the idea of this is that we can then make sure that research aligns with our lived experience expert and patient priorities to make sure that research is actually serving the community in the most efficient way possible. We also conduct our own research in-house, again, using some of that data from the Community Voices in Research Registry. We host virtual and in-person advisory panels, which are really awesome opportunities for our lived experience experts, or LEAs, as we call them, to advise our industry partners and other partners in research as to what the patient and LEA priorities are to make sure, again, that we're really meeting our community needs in everything that we do. And that's just kind of the tip of the iceberg of what we do. So we have some really awesome work going on. If you're interested in learning more, please head over to our website at bleeding.org/research. And with that, we're going to get into the grants, awards, and fellowships that we offer. So we're all patients, we're all caregivers, and research is really important and impactful for every single one of us. It helps to broaden our understanding of healthcare in a hardcore research aspect, such as the biological and chemical side of bleeding disorders, but then also the mental, physical, and emotional wellness of our community, in addition to helping us to understand and improve access to care for everyone. Advances in science improve clinical care options and can really help to further shared decision-making conversations with one's healthcare team so that we can all know what our options are and further advance the quality of life. I'm going to take a minute and give a huge shout out to our sponsors. We wouldn't be able to do this incredible work without you. For over 50 years, our chapters have been helping us to support and advance research, and we can't thank you enough for all your hard fundraising work. It goes to support our Judith Grampool postdoctoral research fellowship. This work is also supported by endowments from the Hemophilia of Georgia and Dale Smith Research Endowment. And then a special thank you to our industry sponsors industry partners who sponsor our Career Development Award and our clinical fellowship. So I'm just going to give you a brief little history of the awards that we have offered and continue to offer here at NBDF. So for over 50 years, we have been committed to providing support to researchers, and we have funded over 194 researchers since the inception of our Judith Grampool postdoctoral research fellowship, which began in 1972. And then in 2000, we got sponsorship to be able to offer our Career Development Award. As the years went on, we eventually started to offer our Excellence Fellowships, and we have just accumulated more awards from there. All of our awards were initially housed in our medical education department, but then in 2017, the research department at NBDF was established. And since then, all of the awards have now transitioned under our department. Importantly, at the end of 2022, we surveyed the community. We talked to the applicants, we talked to our peer reviewers, we talked to our lived experience experts to find out or to really evaluate our grants, the process of applying for grants, the focus of our grants, and the different initiatives that we were sponsoring. And what came out of that was that the community recommended that we really streamline the ways that we accept applications for our grants and manage our awards. And so in 2023, we implemented a new system called Proposal Central, which is a really cool platform that has given us incredible capabilities for not only accepting applications, but tracking applications through time. It allows us to follow up with our researchers to measure their impact, even years down the road. And so this has been a super cool platform for us to utilize, and I'll be telling you about how we use that today and little tips and tricks that might help you to navigate their platform. It's also a cool platform that is used by over 300 other organizations that fund medical research. So it's also a great place to go and search for other funding if you feel like you might not be a good fit for one of our awards. For example, Alex's Lemonade Stand, the Alzheimer's Association, American Heart Association, again, could go on, but I'm excited to tell you about that today. So NBDF is particularly interested in funding research that really is incredibly innovative and is breakthrough research that is really going to help our community. We're interested in developing and advancing multidisciplinary healthcare providers and researchers. And we also really love to support multidisciplinary teams that are pursuing research. And really importantly, we want to keep our LEEs, our lived experience experts, at the center of everything we do. So research that is LEE-centric, person-centric, and prioritizes equity, diversity, and inclusion principles is very, very important to us. And we really prioritize applications and proposals that have focuses like that. So some of the areas that we like to support research in are the biological mechanisms of inheritable bleeding and blood disorders, novel therapies, translational science, clinical advances, quality of care, and health equity, diversity, inclusion, and access to care. So if you are pursuing research in any of these areas and you meet our qualifications for different awards, then please, please, please submit a proposal. We would love to hear about what you're doing and potentially fund your work. This year, NBDF is offering 7 awards. We will be offering 2 Judith Graham Poole Postdoctoral Research Fellowships, or JGPs. We offer 3 Excellence Fellowships, 1 in nursing, 1 in physical therapy, and 1 in social work. We have a Takeda-sponsored clinical fellowship and a Sanofi-sponsored career development award. The JGP and the Excellence Fellowships are now open and we are accepting LOIs. Those are due March 14th. So as I go through the qualifications for each of these awards and our areas of interest, if you're eligible and you're interested, submit that LOI soon, please. All right, our JGP is a award where we will, excuse me. Our JGP is a $52,000 a year award for up to 2 years. This award is in honor of Judith Graham Poole, who is best known for her discovery of cryoprecipitation in the 50s, which is a process for creating concentrated blood clotting factors, which if you're in the field of bleeding disorders, you know that that has significantly improved the quality of life for our community around the world. In order to be eligible for this award, you need to be a postdoctoral researcher. And some of the areas of interest for this award are biochemical, genetic, or hematological aspects of bleeding disorders. This is just a general list, this including these things, but not limited to. So if you have any questions about whether or not your research might qualify, then please reach out to us. We would love to discuss that with you. Our Excellence Fellowships are $15,000 awards for 12 to 18 months. In order to be eligible for these awards, you must be a nurse, a physical therapist, or a social worker in a clinical treatment center setting. And some of the areas of interest that we have for these fellowships are maybe you're looking for ways to improve clinical care and treatment strategies, or you have ideas on how to enhance the psychosocial and community support. Maybe you are wanting to advance patient and provider education. Again, these are some examples, but our areas of interest are not limited to these. Sanofi has very generously since 2000 sponsored Sanofi has sponsored it for the last few years, but we've had this award since 2000, our Career Development Award. It's a $70,000 award per year for up to 3 years. It's for established investigators at the assistant professor level or above. And I will add on to this that we prefer that you are no more than 6 years post your postdoctoral fellowship to apply for this award. And some of the areas of interest for this award are the development of novel technologies or therapies to advance the field of bleeding disorders research. And finally, we offer a clinical fellowship that is sponsored by Takeda. This is a $100,000 a year award for 2 years. This is a different award than like a research fellowship. This is a clinical fellowship. So in order to be eligible for this, you have to be a medical director or senior faculty member administrator affiliated with a U.S. hemophilia and thrombophilia treatment center. So it's not a traditional research award, so we don't necessarily have areas of interest. Instead, the purpose of this award is to increase the number of clinicians that are committed to providing care for people with bleeding disorders. And this program includes mentorship and hands-on clinical training to prepare licensed physicians for academic careers in bleeding disorders research. All right, so in order to access the application, if you qualify for any of these and are interested in applying, please go to our website, bleeding.org, and under the research tab, you can go to a page that is specific to whatever award you are qualified for, the Judith Graham Poole Postdoctoral Fellowship, the Excellence Fellowships, etc. And partway down those pages, you'll see a box like this that has this button, Submit Your Letter of Intent. Please read all of the instructions in this box. Otherwise, you might get kind of lost along the way. You can also scan this QR code and it'll take you to, again, proposalcentral.com, which is our platform for accepting applications right now. So if you click that Submit Your Letter of Intent or scan the QR code, it will take you to the Proposal Central homepage. The first thing that you're going to need to do is create a profile. Once you have created your account, it will then ask you to fill out information in your profile, such as your adding in a bio sketch, filling in information on your institution. We also do require an ORCID ID be entered into all of these profiles. This not only helps us to keep track of your publications during your award, but also after your award. And then we can see the impact of this award and your research over time. So it's really important that we get this information from you. So once you've filled out all that information, if you go over to this Grant Opportunities tab at the top of the page, it will take you to the portal that has, or the database, excuse me, that has all of the current awards that are available through Proposal Central. You'll notice here that I took this photo this morning. There are about 300 opportunities available. So again, this is a really awesome platform to just go and search for different funding opportunities that you might be qualified for. Once you click over to this tab, if you search national bleeding disorders in the search bar, then all of our current open programs will show up for you. And you can click Apply Now next to whichever program you are interested in applying to. It will take you to our LOI page where you can fill in the different sections and send in all the required materials that we need. All right, so let's talk about the timeline of the currently open awards, which are again, the JGP and the Excellence Fellowships. Our letters of intent are due March 14th at 11:59 p.m. Eastern. Those LOIs will then be reviewed internally by NBDF, and qualified applicants will be invited to submit a full application. Once you are invited to submit the application, you will then have access to a similar platform like what you just saw with the LOI on Proposal Central. The section requirements will be a little different. It's a little more thorough, and I'm going to go over the materials that you'll need for that in just a second. Those applications will be due April 25th, again at 11:59 p.m. Eastern. And I will mention this a couple more times, but our applications require letters of support from not just your sponsor or mentor, but also your institution and the medical director of your institution. So please ask people early for those letters because they often take longer than you think that they would. Our peer reviewers will review and score these applications in May of this year utilizing NIH criteria. And then in June, we will send out acceptance and denial letters. If you are awarded, we will begin the contracting process. If you are denied the award, we will provide you with constructive feedback. So please take that into account if you have applied in the past or would like to maybe try and apply again in the future. We would love for you to apply again. Unfortunately, we can't award everybody as we would like to, but we are happy to help guide your application for the following cycle. All right, so some of the application requirements. We are going to obviously require a project title, summary, narrative, if you will, with an abstract references in addition to a timeline and budget. So this is really where you tell us the objectives of your project, how you're going to assess your results, and why it's important that we fund your research. If you're using human or animal subjects in your research, we will require IRB and IACUC documentation. Once again, we require letters of support from your institution, the medical director, and the sponsor or mentor. We will also ask for NIH biographical sketches for the app for yourself as well as your sponsor or mentor. And then we will have a section of the application that asks you for demographics, your education, additional training that you've had, what your background might be, your HTC affiliation, and any other funding sources that you currently have. And finally, there's a signature page that is required for you, your mentor, the medical director, and your institution. So again, really, it's a lot of material to pull together. So please plan in advance and prepare to submit all these materials by April 25th. Okay, so as you're putting together your application and all of these materials, we have some tips and tricks for you to not only improve your application, but make our review process a bit easier. So as you're putting your application together, please, please, please follow the guidelines. Again, it makes things a lot easier for us if you are reading the instructions really thoroughly and meeting all the required criteria. We also ask you to put yourself in our shoes if you were NBDF reviewing your application. Are you meeting NBDF's, again, back to that mission statement in the beginning, are you meeting our goals? Are you helping us to meet the needs of our community? And how can you explain your project in a way that, again, helps us to better understand what you're doing from a broader perspective of improving the quality of life for people in the bleeding disorders community? And again, give ample time to gather required signatures. Sounds quick to just sign a page, but it always is like pulling teeth to get all of these things together. I say from experience. So please set yourself up for success with a really with a timeline that will make sure that you get all that in time. All right, as you're putting together your application, again, think about how you can clearly describe your specific aims and objectives. What's the impact of your project? What are your deliverables or measurable goals? And how are you going to assess the success of this project? Finally, we ask that you ask your mentors and peers to review your submission before you turn it in. I cannot recommend enough. The more eyes that you have on an application, I think the more holistic feedback you are able to get and incorporate. So please have people peer review your work and also avoid jargon. We do have experts reviewing these applications, but you never know if they're experts in a niche field that's really tangential to yours. And so there's things that may get lost in using jargon. So simplify it as much as you can for us. Speaking of our expert peer reviewers, we impose a really rigorous scientific peer review process for these applications. It's a confidential panel of reviewers, and we select them based on their expertise in addition to the focus of your proposal. So we try to line that up as much as possible. And again, so that it's experts in your field that are reviewing this application. They then review and score the application using the NIH criteria, which are significance. So how relevant and applicable is this project to the funding opportunity? What's your approach? Are you being effective and efficient? Is this an innovative project? You, the investigator, what is your history and your success rate? And your environment, so your mentor, the institution that you're at. These are all things that we take into account when we're reviewing your application, so consider these as you put it together. Our reviewers then make their recommendations to NBDF, and NBDF awards the most qualified awardees. If you are awarded by NBDF, we then have a monitoring and ongoing support system set up for you. So we require routine progress reports. We'll check in with you every 3 to 6 months throughout the duration of your award. And we will ask for financial audits during the course of that time. We also will feature you as an awardee on our website. We'll have different speaking opportunities available for you. And then there's always lots of options for participating in NBDF programming, like at our Bleeding Disorders Conference, speaking at our research journal club, presenting in a Wednesday webinar like I am right now. We'll celebrate you on social media and so much more. And then finally, there's lots of opportunity to engage in future NBDF research, such as serving as a peer reviewer on our peer review panel for future applicants, participating in the Bleeding Disorders Research Collaborative, which was formerly the National Research Blueprint. And again, this would be, you would work with our lived experience experts to make sure that your research is meeting their needs. We may ask you to help with grant revision, et cetera. Lots of opportunities to stay engaged with NBDF. If you are one of the individuals who might be eligible for our Takeda Clinical Fellowship or our Sanofi Career Development Award, and are interested in learning or in hearing about when those LOI submissions open, I encourage you to sign up for notifications on our homepage. So if you go to bleeding.org, you can do this from the homepage. You can also do this from the research page. But then if you click subscribe, either in the top right-hand corner above the search bar, or sometimes it's on the banner that cycles through, it'll take you to a page that says subscribe and stay connected. Enter your information and make sure to check research and medical advancement. And then you'll get the e-blast that goes out to those who are notified or who have signed up for notifications that will let you know when those next cycles are opening up. And if you are interested in seeing other research that we have funded in the past, one of those 194 awardees, then you can also find that information on our page. It's at bleeding.org. And if you go to the research tab and then select funded by foundation under research projects, it will take you to a database that will allow you to search the awardees, their institutions, their topics of interest, their research projects, all of that awesome information. And it's a great way to see if you might be a good program fit, or if you're trying to get a little inspiration for some research projects. That's a place where you can find tons of information. And just going to reiterate that we are offering 7 awards this year, and 5 of those awards are now accepting LOIs. So please, if you qualify and you have an idea for research, submit an LOI. I also invite you to reach out to our team, connect with us. We're happy to discuss whether or not you think a project would be a good program fit, or to even develop a project with you. I'm just going to do a quick plug here for our Bleeding Disorders Conference. This year, it's going to be hosted in Aurora, Colorado at the end of August. This is a really phenomenal NBDF event that brings together patients or lived experience experts, family members, clinicians and healthcare providers, researchers. It's really just the whole bleeding disorders community coming together for a few days of incredible sessions and presentations, and we would love to see you there. So you can scan this QR code to register, or you can find information on our website as well. I just want to thank you again all so much for taking the time to be here today. Please connect with us on social media to stay updated. We post our award announcements. Again, when those cycles go live, we post those on social media. You can go to our website for more information. And if you have any other questions, please, please, please reach out to me. Reach out to Sam, who is another wonderful member of our research team. Maria, we are all happy to discuss these funding opportunities with you and provide whatever information we can.
Thank you, Hallie. Thank you so much. I think it's important to note also that these webinars are always recorded, and this is no exception. And so it will then now live in our YouTube channel, where people can access it at any time if they have any questions. So thank you, Holly, for that great overview. I think that it's clear that we are very excited about opening a new cycle of research awards. We have been funding research in our community for 75 years. For 50 years, I'm sorry. It will be 75 very soon.
Yeah.
50 plus years, and we're very excited. You know, we're most excited about this new the new platform that we have for where applications will live and that would allow us to administer the grants with a lot more ease. But also it will help us also track a lot of those early researchers that have gone out to do amazing things in our community, that are still engaged, that are still doing great work, and that have been able to translate those early basic scientific experiments into now, amazing therapeutics in our community. So that's always very
Yeah.
excited. So thank you for that overview. I also wanted to reiterate the thank you, right? We cannot do this alone. I think we're very good at providing the opportunities at evaluating proposals in a way, in a scientific, rigorous manner, so to make sure that our awardees are set for success. But we cannot do that without our supporters. So thank you to Sanofi, who's specifically funding the CDA, which will be open in the coming months, but also everyone in the community, right? Chapters and individual donors that through their chapters or directly to NBDF are donating to make these research grants a reality. So I really want to thank them. Holly, so if anybody, I mean, you show the website, and I love that you saw that you show the screenshot so that people can actually familiarize themselves with their setups. I know that our websiters can be a little bit tricky to find things sometimes, but if they can't find what they're looking for, I know that you said that you have explanations of what each grant does. You have examples about older grants that we've funded. But if they don't, if just tell them a little bit of our philosophy when we get an email saying, help, can you please help me, figure this out? I can't find it in your website, or maybe, a related, but not a question directly to that kind of information. So please, I think I want you to go into the philosophy of where the research team lies when we get those inquiries.
Yeah, definitely. So the research team, I mean, the team element of it is definitely the biggest thing. We'll work together to make sure that we can find you the answers that you're looking for. If you're having questions on Proposal Central platform specifically, the Proposal Central support team is also incredible. I just want to mention that if you're ever having issues on their website, they respond incredibly quick and they are so, so helpful. As far as our philosophy as a department, LEEs, our lived experience experts, are at the center of everything we do. And so all of our decisions are based on, is this going to be beneficial for our LEEs? Is your project going to, again, further access to care, quality of care, understanding of care for this community? We are always happy and open to have a discussion with you. If you have an idea for a project, but maybe aren't really sure how to implement it, reach out to us. We would love to talk about that with you and set up a research plan with you. I mentioned earlier sort of the ongoing support and engagement that awardees have with NBDF, but we're happy to start that before you're even an awardee. We want to be engaged with you. We want to hear about the really incredible work that you're doing in this community. And thank you for the work that you are doing in this community too. This is such important work, and we wouldn't be able to do it without you, and your research is truly impactful and important. So
yeah, thank you. And I think it's also very important when you think about early researchers for where our JGPs are targeting, and also the fellowships that also target disciplines that are not necessarily taught how to do research in school. Nurses, physical therapies, maybe not the doctor of physical therapy, maybe they get a little bit more about the research process. Social workers, we're here to help you. We're here to make you successful, to succeed in your programs. Clearly, we can't write that application for you, but we can give you an idea of what, our evaluation criteria, what it is that we're using to evaluate all those proposals to make sure that they're comprehensive and that they touch on all those bases. So reach out to us. Research at bleeding.org is another good email if you don't remember our names. But our names are all plastered around the website, so you can reach out to us at any time. So yeah, that's definitely very important. Um,
Yeah.
I
And
I
we've
think go ahead.
Oh, I was just going to say it. We've said it before, but I'll say it again. If you're not sure if you're a good fit for these programs, then tell us about your research, ask us what we think, and we may be able to direct you towards, hey, you're actually a way better fit for this fellowship than you are for this, award and that. So by all means, just any questions you have, please.
And the last thing that I wanted to say was, sometimes in those fellowship applications, the nursing social worker and PTs, we have had instances in which we've had a team of researchers and social workers who work on a project together, and instead of asking for the 15,000 for that 12 to 18-month period, they can ask for 30 if their proposal is a little bit more comprehensive and it relies on both expertise. So I think that we're very, very flexible, and all those things are definitely things that you can ask and you can reach out, and we'll have answers for you. We've been doing this for a little while, so I think that we've got a lot of inquiries that if we can't solve them immediately, we'll figure it out together.
Yeah.
Amazing. Well, I think that provides a really good overview. I think that, clearly we're doing this through the Ultim. We've been doing this is the second year now, so we're a little bit better equipped to do it. The nice thing like you said, for the researchers is that they create a profile and the profile lives there forever and they don't have to recreate a profile every year. And it also has access to other granting opportunities. So
Mhm.
I think that it's a good things for many of us.
Yeah, definitely.
Anything you want to add before we close up?
We look forward to reading your applications. This is a very fun and exciting time for us as a department. It's so inspiring and just awesome to hear about the amazing research that y'all are doing or these really innovative ideas that you have for ways that you can learn more about and help out your community. So thank you again for the work that you do, and we are so excited to hear about what you're doing.
Absolutely. All right. Well, thank you, Holly, for that great overview, and thanks everyone for joining us.
Thanks
Send
for
us your applications.
joining me.